The contraceptive vaginal ring is a soft, flexible, plastic ring that goes into the vagina. It's really easy to insert yourself and stays in place for 3 weeks. After this, you have a 7-day break. It contains a combination of 2 hormones, progestogen and estrogen. These work together to prevent an egg from being released, to make it harder for the sperm to reach the egg, and to make the lining of the uterus thinner so an egg can't implant. The contraceptive vaginal ring is 99% effective at preventing pregnancy. But remember, it doesn't protect you from STIs, so make sure you use a condom too. You may experience some short-term side effects, but there can be lots of perks too, like clearing up acne, easing cramps, and making your periods lighter and more regular. If you're under 25, you can get the contraceptive vaginal ring from Brook Services. Alternatively, you can go to any contraceptive clinic or your GP.
Contraceptive implant. The implant is a popular method of long-acting reversible contraception, or LARC. It's chosen of any age. Pill. The implant is a small, flexible plastic rod. It's fitted just under the skin on your upper arm. It will plastic rod. It's fitted just under the skin on your upper arm. It works by releasing a tiny amount of a hormone called progesterone into the bloodstream. The progesterone stops your body from releasing an egg each month, so preventing pregnancy. The implant is almost invisible under your skin, so nobody else can tell it's been fitted. Why do women choose the contraceptive implant? It doesn't get in the way of sex, unlike condoms. Once fitted, you can forget about contraception for 3 years. Once removed, your fertility will return to whatever is normal for you within days. Before the procedure, the implant can be fitted at any point in your cycle, provided there's no chance you could be pregnant. We ask that you don't have unprotected sex for at least 3 weeks before fitting. This includes sex when your method of contraception has passed its expiry date, or using withdrawal or natural methods of contraception. How is the procedure done? It only takes a few minutes to put the implant in. First, you'll meet the clinician who's fitting your implant. We'll ask you about your medical history, do a pregnancy test if required, an STI test if needed, and answer any questions. We'll numb a small area of your arm with local anesthetic, which may sting slightly for a few seconds. Then we'll slide the implant under your skin. You might feel some pressure, but no pain. We'll put a dressing on your arm to cover the small cut made by the insertion. Most clinicians also apply a pressure bandage to reduce any bruising. After the procedure, most women feel well enough to leave the clinic straight away and can travel home by bus, taxi, or car. You may like to bring someone with you to take you home. After the local anesthetic has worn off, you may have some tenderness or swelling around the implant. This can last for a few days, and the area may look bruised for up to a week or 2. If the implant is fitted during the first 5 days of your period, you're protected from pregnancy right away. Otherwise, we advise additional contraception, such as condoms, for 7 days. We'll give you a card with the expiry date written on it. Keep this safe. The device can be removed at any time. We recommend you use an alternative method of contraception before the removal, so there's no gap in your protection against pregnancy. Side effects. Most women have no problems. Around 1 in 10 women notice hormonal side effects in the first few months, such as headaches, breast tenderness, weight gain, or spottier skin. The side effects usually settle, and they occur with other progesterone-only methods of contraception. We recommend trying to find the method that's best suited to you. The implant can affect your periods in 3 ways, but we can't predict your individual outcome. For 1 in 5 women, periods stop altogether. 3 in 5 women have bleeding that is either infrequent or light, but it is acceptable to them and they are happy with the device. However, 1 in 5 women have bleeding that is prolonged or frequent. If this happens, we might suggest you take the contraceptive pill in addition to the implant for a few months. Risks. Very rarely, your arm can become infected. We'll provide you with full wound care instructions. It's safe to use the implant while breastfeeding. It shouldn't affect how much milk you produce, and it won't harm your baby. In fact, the implant is a great method to use if you're breastfeeding and you don't want to get pregnant. Importantly, the implant does not protect you against sexually transmitted infections. We recommend using condoms until both you and your partner have both had an STI screen. Questions or concerns? If you'd like to see or
Contraceptive injection controls your fertility in order to prevent pregnancy. One injection can protect you from pregnancy for 8, 12, or 13 weeks, depending on the type. You just need to remember to get them on time. It contains the hormone progestogen, which works to prevent an egg from being released, to make it harder for the sperm to reach the egg, and to make the lining of the uterus thinner, so an egg cannot implant. The contraceptive injection is over 99% effective at preventing pregnancy. But remember, it doesn't protect you from STIs, so make sure you use a condom too. You may experience some short-term side effects.
Select an area of your skin that is clean, dry, and free from excessive hair. Be sure to follow your product instructions as to site selection and rotation. If required, hair can be clipped with scissors close to the skin, but the area should not be shaved. Ensure the area is clean and free from oils, powders, and lotions, so the patch sticks well to the site. Remove the patch from its package only when you are ready to use it. When removing it, be careful not to cut or damage the patch in any way. If the patch is damaged or altered in any way, do not use it. A stiff protective liner covers the sticky side of the patch. This is the side that you will attach to your skin. Remove the protective liner according to your product directions to expose the sticky adhesive layer. Be sure not to touch the sticky side of the patch. Some protective liners are removed in 2 parts. If so, remove one part of the liner and place the sticky half of the patch on the area of skin. Then gently peel off the remaining liner to attach the rest of the patch. Apply the patch to the site or sites in the product-specific instructions or as directed by your doctor or pharmacist. Press down on the patch with the palm of your hand to smooth it down. Make sure the patch is flat to the skin and there are no bumps, folds, or bubbles under it. Then use your finger to press down along the edges of the patch. If the patch does not stick well or loosens after application, you can tape the edges down with first aid tape. Refer to your product information sheet for additional information on how to deal with this problem. Once the patch is applied, dispose of the protective liner and package as directed by your instruction sheet, and wash your hands. Even a used patch may contain enough drug to harm others, especially children and pets. It is important to dispose of used patches and packaging properly. Wear the patch for the amount of time directed by your doctor. With each new patch, remove the old patch and change application sites according to your product's instruction sheet. If you are not sure when to change the patch, check with your doctor or pharmacist. Some patches have special labels to help you track when to replace the used patch with a new one. If not, it is a good idea to note the time and site of application on a calendar to help track usage.